So I suppose I'm going to take a slightly different approach. I suppose up to now we've been very much, very much kind of looking at the outdoor environment, and I suppose I'm kind of transitioning more to the indoor environment, trying to look at, I suppose, the interactions between these. And I suppose when Aisling asked me to speak, we put forward the topic of, I suppose, ventilation and indoor environmental quality. And I suppose the environmental quality is actually very important in this context, but we mean typically something quite different when we talk about the outdoor environment. And in this broad research remit, we're trying to really transition away from the concept of indoor air quality to environmental quality. And unfortunately, I won't have time to get into the whole complexities of it, but when we talk about environmental quality, it's air, it's thermal comfort, it's lighting, it's acoustics. But even though not all of them have the same health implications, they actually drive a lot of fundamental change. So for example, we'll take, if someone's house isn't warm enough, they're not going to open a window during winter. If someone's cooking and the extractor fan is too noisy, they're going to turn down the settings. So even though some of these environmental factors don't necessarily have direct health outcomes, they can very much have a direct impact on the air quality that we're dealing with. And just, I suppose, to bring on one point that was raised earlier on, I think Ian mentioned it, he talked about the home or the residential environment as sheltering kind of from, I suppose, outdoor air pollution. And it was actually interesting when I was out in the lobby, there was one of the reports done by the ESRI, and it was, what are the environmental factors that you're aware of that can impact your health? Outdoor air pollution was listed as 59%. Indoor air pollution, let me clarify, indoor air was 3.7%. Okay, and there's a huge disparity between these two. And I suppose what I want to showcase is that's not actually the case. If we think about outdoor air, but where are we exposed to the outdoor air, but it's in our home? So the whole concept of our home being this safe, protective environment isn't always the case, unfortunately. So I suppose we can all imagine leaving here this evening, wanting to go home, put on your slippers, curl up on the couch, watch something on TV and unwind, thinking it's that safe environment. But the reality is that's not always the case. So if we look broadly at the built environment, and I suppose I should say I'm focusing mostly on the residential sector, just because it's the kind of the primary focus of our work at the minute, but it does extrapolate outwards. So if we talk about ventilation, really ventilation has this dual role, both positive and negative. So it's bringing the outdoor air pollution into the building. So the higher the ventilation rate, the more pollution we're going to drag into the building. There's various different factors of indoor sources that we need to consider. Cooking, solid fuel burning are kind of a couple of the main two. Smoking is another one if we're looking at particulate matter, but there's a whole range of other factors. And then ventilation pulls that indoor generated sources outwards. So there's this dual relevance between ventilation. It can actually increase the influx of outdoor air pollution, but dilute the indoor generated sources. And it's trying to balance these two factors. So when we talk about the indoor environment, we're talking about spending 90% of our time indoors. Okay, that's either at home, it's in our work, it's in our car environment. So it's this broad sector. The outdoor, we talk a lot about outdoor air pollution, but the exposure to outdoor air pollution largely occurs indoors. So really what we need to think about is how is the building interacting with our indoor environment? The reality is sometimes these indoor air pollutant concentrations can be 2 to 5 times higher than outdoors, depending on the sources that we're looking at. And then certain things, the sources and compositions can vary compared to outdoors. Just if we talk briefly about the indoor air pollutant sources, we've particulate matter, 2.5. So these can come from anything from cooking, smoking, solid fuel combustion, outdoor infiltration inside, particularly resuspension. If particles go on the floor, kids running around, we'll put that back up in the air. Candles, incense, these all contribute to large amounts of PM2.5. NO2, CO, radon is a naturally occurring radioactive gas, which hopefully most people are familiar with, but it's a particular regional challenge in Ireland. There's some broader chemical components that we need to be aware of that very much come from building materials. And particularly in the context of energy retrofits, these can pose a challenge as well. So some of it's BTEX, which is kind of 4 different compounds. There's formaldehyde, which is a known carcinogen. And then there's TVOCs, which is just a broad collective term for total volatile organic compounds. But within that, there can be 10,000 different chemicals in the air. Not all of them have, I'd say, documented health effects. Okay, whether we just don't have the evidence to suggest they're harmful, or they're not actually harmful themselves. We're still trying to, assess this in the ventilation or in the air quality remit. But obviously, just to highlight some of the severities of what we're actually dealing with. So this was kind of one of the first cases the first case in the world where on the coroner's report, the cause of death was actually associated with air pollution. So we typically associate air pollution having premature deaths, but this is one of the first cases where it was actually associated as the direct cause of death in the UK. Similarly, there was a child, I think of 2 years of age, died from essentially excessive mold growth in the home that caused a lot of respiratory issues. I suppose on the positive side, and again, I suppose trying to take the theme of lessons learned, this was one of the recent events. It was only actually, I think it's a month ago, tomorrow, that was held in the UN headquarters in New York. So it was a collective action globally between France and Montenegro with the two supporting organizations. But what we can see now is globally there is drive towards improving indoor air quality. And it kind of just shows some of the momentum that's coming behind it. There's a lot of the organizations, either member countries, and behind them are research organizations. And so one of them is ISIAC, the International Society for Indoor Quality and Climate, and I'm currently sitting on the board in that society. I suppose, and again, in a very much a positive term, when we talk about buildings, the changes in building performance has largely been driven through trying to reduce our climate emissions, trying to make our buildings more energy efficient. And we've seen that, I think, from Ian's talk earlier on, the downwards trajectory of the emissions. And we do, rightly so, need to achieve this. The challenge is we need to balance the energy performance of a building with the indoor environmental quality. In simple terms, if we seal it up too much, we're just going to trap more things inside. We might reduce the outdoor stuff coming in, but we're going to just trap more of the indoor generated pollutants. But one of the key messages from this is within the this is the European the European Energy Performance of Building Directives, which was just revised last year. And one of the key things for this is now indoor environmental quality is specified as a requirement within these regulations. So just a couple of the examples within it, they say they have to take into account the outdoor climatic conditions, the local conditions, the indoor environmental quality, and the cost effectiveness. Similarly, as we kind of go down into the articles, I think this is kind of one of the powerful things is we're saying the requirement shall take into account of the optimal indoor air quality. So historically, we very much look for adequate indoor air quality, and adequate, I suppose, is a subjective term. Some people can view it being quite good, but optimal now is really trying to push the boundaries forward. So it's not just trying to make our buildings energy efficient, it's now putting indoor environmental quality on par with these. And this is coming from Europe. Just within these, some of the pollutants that are measured, I've actually managed to cut off CO2. I suppose just in the indoor environment, we typically don't associate CO2 as a direct pollutant because it essentially comes from exhaled breath. But what it does do is it gives a very good metric of the performance of the ventilation systems. But we do have PM 2.5, formaldehyde, NO2, radon, and carbon monoxide. I suppose, again, trying to take the theme of kind of historical overview and looking forward, some of the good news is, so if we look in Ireland over roughly the last 2 decades, we can actually see that the changes in the regulation, work law done by the RPII and the EPA, have actually seen that the national average has gone from 89 becquerels down to 77 becquerels. But bear in mind, that includes the existing building stock as well. So it's not just kind of the old and very much new, it's as a collective. So it's showing how changes in this remit are actually being quite positive. In Canada, they've actually seen some of the opposite effects, where changes in the building codes to make them more energy efficient have actually increased the radon. But as a result now in Canada, what they've done is they've mandated passive stack ventilation. So this is to remove the radon before it ever comes into the building, essentially a source control method. But as of this, I think earlier this year, that's just come into their building codes. Just to give an overview of some of the research we've done in Ireland, I just realised I'm talking too much on earlier slides, but this was one of the projects that I was involved in when I was in the University of Galway as a postdoc with Dr. Miriam Byrne, and we looked essentially at energy efficient buildings, so A-rated buildings and how they perform with their indoor environmental quality. And again, don't want to get into the whole complexities of every aspect because I could have a whole talk on just this project, but really in terms of the radon, this is what Aisling asked me to focus on, was really what we could see is in the energy efficient buildings, our radon levels were reduced. As a representative sample, the average we measured was about 71 becquerels, which was only about of 80 buildings, so it wasn't designed to be a representative sample of radon, but was comparable. What we did notice was the 6 buildings that exceeded our 200 becquerels, 4 of them were retrofitted buildings. So we did notice that retrofit is really a challenge in the radon remit. Just kind of in the interest to keep going, we talk about energy poverty. Again, this is a huge, obviously, issue presently, but even over the last few years. So I don't know if you probably can't see it, this was a newspaper article, from the RT News, which is back in January of this year. So we still see energy poverty is still a huge issue in Ireland. It has implications, obviously, for thermal comfort, but the challenge is then there's a lot of knock-on effects for indoor environmental quality, and we can even see examples of mold growth in these homes. And we have an ongoing SEI project at the minute with Anne Nolan's involved in this, and we're trying to assess the implications for energy poverty and the broader health aspects in Ireland. I suppose where some of the benefits from this come from, and again, not going to dwell on all of the study, but just as an example where we do have successful measures of retrofit, this was work done through UCL, I think, in London, and what they looked at was the warmer health and wellbeing scheme that was being carried out in Irish homes. And when they retrofitted these buildings, in the broad aspects, they were able to find that there was a reduction in the amount of drugs used in these groups. So obviously, this was a specific subgroup that was targeted. I think it was from memory, it's the elderly cohort. But obviously, the retrofit improved the thermal comfort, so they were more comfortable, it reduced their energy bills, but there was a direct measurable benefit on the health outcomes as well. But one of the key findings was essentially ventilation had to be included as part of the energy retrofit. And I suppose what I'll show quickly is, if that's not the case, what actually happens. So just a few different studies. This was a review paper, but generally the broad consensus was if ventilation isn't considered properly, air pollution will go up. So they could see that radon and formaldehyde had a tendency to increase. So again, this was 36 studies across Europe and the US. Other VOCs had a tendency to vary up and down depending on the cohort. Dampness and mold typically reduced, and I suppose we would expect that as the building is becoming typically warmer. CO2, again, typically started to increase if ventilation wasn't considered, but decreased when ventilation was added. And then, as we'd expect, the indoor temperature does largely increase. A couple of studies just from Ireland, and again, the similar broad consensus that certain pollutants were starting to increase when ventilation wasn't considered. And I suppose just the thing to really point out with these is there was a poor level, even though ventilation was installed in the buildings, it didn't necessarily mean it worked properly. Okay? And there's various different reasons that this can occur. Some of it can be compliance and installation, some of it can be, and there's certain issues, I think, just where the fuse board went. But the whole idea, and this will come back to my topic of environmental quality, is if the system is working properly, we shouldn't hear it. So when it fails, you don't necessarily know that it's failed. So it has a lot of interactions with these systems. If we look specifically at radon just for a minute, we talk again, I suppose, radon really in terms of energy retrofit is a challenge if ventilation isn't given due consideration as part of the process. One of the French studies that I think from memory, it was about 4,000 homes across Brittany, they noticed a statistical difference between homes that were retrofitted and that didn't have a retrofit. And typically, it was about 50% higher. There were similar studies done in Switzerland, I think from about 700 to 800 homes, found the radon levels were about 20% higher. Work done by the Irish EPA actually interestingly found, while the average was the same, there was quite a spread in the data. And really, that's where one of our previous projects that was funded by the EPA, which was the Unveil project, we tried to assess this. And at the time, basically, our key findings were if ventilation wasn't considered, the radon levels could nearly double within the home. If it was considered, you could actually have if ventilation was incorporated into the retrofit, you could have a very successful outcome. And we're currently kind of running a project to try expand this information. That study was very much focused on shallow retrofits, but as we move to more deeper energy retrofits, we need to be aware of these broader implications as well. And I suppose we just currently have a study with this, but we're actually involved in trying to monitor essentially the pre and post radon concentrations, and we're largely engaging with a lot of the local authorities. So if there is any local authorities that are doing retrofit, I'd love to chat to you at the end. Just, I suppose, kind of finishing up in the interest of time, but I suppose some of it looking forward, and just want to pull out one key message from this is we're very much focused on, I suppose, climate change mitigation, trying to look at it. But we're now making the buildings so energy efficient, they're starting to overheat. And I suppose historically, if I said 10 years ago our Irish buildings were going to overheat, I'd probably laughed off the stage. But the problem is, it's not necessarily, it's solar gain. Any extra in-loft solar gain will cause these buildings essentially to get too warm over the summer period. Just, I suppose, I'm nearly out of time, but just there is some positive messages. We've had SR 54, was kind of code of practice for energy retrofitting of buildings. That's now currently being revised, and there's supposed to be a document out later this year. There's the Healthy Homes document that's been put forward by Velux, and then there's the code of practice for our indoor air quality in the workplaces. It's one of the few in the world that has started to propose where indoor air quality should be considered in the workplaces, and then where we need proper ventilation. And again, just very briefly, I just kind of to highlight that, one of the last things just to stay here is, while we have a lot of evidence to suggest that mechanical ventilation is quite positive in these buildings at the start, we're still missing this piece of the longer-term operation in Ireland. We don't have a culture of mechanical ventilation. So I suppose just to think about this, when was the last time you changed the filter on your kitchen extractor hood? Yeah? So I suppose if that's the case, are people going to do these in the mechanically ventilated homes where there is filters a part of it? So, and I think we just need to be aware of this. We need a cultural shift to make people a lot more aware of it. But we also need to start, I think, unfortunately, looking at climate change adaptation as opposed to just mitigation. And I suppose with that, thank you.